Living with COVID-19 is not just accepting that COVID-19 is around. It's a way of life. And these are the principles of living with COVID-19. It's a lifestyle change, and Lagosians have got to get this lifestyle change. This is probably the most important slide. Number one, wear your mask in public. That decreases the amount of vapor that you produce in the environment, and if you're positive, it will protect people around you. Number two, practice strict social distancing. You still see people at bus stops or at events standing absolutely next to each other. The distance is 2 meters apart. And we've got to learn that as Lagosians. Keep your distance. If you're sitting in a place, keep your distance. If you're standing, keep your distance. You as a person who doesn't want to catch COVID, be conscious of who is around you and tell somebody who is getting too close to you, please practice social distancing and give yourselves between 1.5 to 2 meters distance between each other. That dramatically decreases the opportunity for the virus to move from one person to another. Again, number three, discouraging mass gatherings. This is not the time for crowded, under-ventilated, push me, I push you kind of gathering. No. If you are going to have a gathering, follow the guidelines. Space people out, not more than the recommended number inside. If you can do it outside, preferably, and stick to the guidelines, and find yourself requesting permission from the Safety Commission if you want to carry out an event. And this applies to both social activity and religious activity. There is no difference. The virus does not know any difference. A gathering is a gathering. And we need to exercise the strict guidelines that the government has put in place, both at the federal level and at Lagos State level. Personal hygiene, hand washing, hand sanitizing. If you sneeze, sneeze into a handkerchief. Go and wash your hands afterwards. Avoid handshakes. It's not the time to start handshakes again. Carry on with the COVID greeting, which is either a nod, or if you have to touch the person, you use your elbow if you have to. It's not necessary at this point in time. We're in a pandemic. A greeting at a distance should suffice. Number five, if you are not well, especially if you have typical COVID symptoms, catarrh, cough, weakness, shortness of breath, fever, tiredness, loss of taste, loss of smell, chest pain, go and get tested. There are lots of people in Lagos who think they are supermen or superwomen and they stay at home. Sometimes you don't want to get tested because you're afraid of the stigma. But just imagine who you are putting in danger. If you know your status, then we can check the rest of your family. And if there are vulnerable people in your family, we can do things quickly that can protect them. If you've gone to the office and you're symptomatic, that is irresponsible. Go and get tested first. And if you're positive, then you isolate yourself. If you're mild, you can isolate yourself at home. If you're unwell, through our EKOTELEMED, once you're positive, you will flag up on our system. We will contact you, or you can reach us. We're open to all communication. And if you're sick at home, we will recommend that you be admitted to a hospital, an accredited isolation facility, not any old hospital. You must protect the hospitals in Lagos. If you have COVID-like symptoms, do not just walk into any hospital. There are government and private COVID-19 accredited facilities. COVID-19 is not for any hospital, and you will be putting staff of those hospitals that are not accredited to manage COVID-19, and you'll be putting patients that are going to that hospital for other activity. You'll be putting them in danger. So after your test is positive, or you feel like you have COVID-like symptoms, don't walk into any hospital. There are designated hospitals for COVID-19, and you'll find that on our social media handles and in the press and everywhere. The hospitals, the main hospital is the IDH in Yaba, or you can just call EKOTELEMED and we will tell you which hospitals you can go to for care.